بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أنتم تعرفون جيدا مدى اهتمامي بصحة المرأة وجمال المرأة، وماذا يمكن أن تفعله في وجهها، وماذا يمكن أن تأخذه من مكملات غذائية على مختلف مراحلها العمرية لكي تكون بصحة وليكون شكلها كما تريده طوال الوقت، ولا تعبث به أنامل لتغيير الشكل بما لا يرضي من يراها دائما. فمنذ عدة سنوات قمت بافتتاح مركز دلما الطبي ودلما سبا، وكان الهدف الأساسي هو العناية بالمرأة والرجل والأطفال في مختلف التخصصات، وقمنا بالتركيز على التجميل. وعلى مدار سنوات طويلة تعرفت على أفضل أطباء التجميل في العالم أجمع. واليوم معي دكتورة إفي كتسارما، وهي رئيسة قسم جراحة التجميل في مستشفى تشيلسي ويستمنستر في لندن. ويسعدني أن تنضم إلى أسرة دلما وتحضر إلينا كل فترة لتقوم بعمل مختلف الأشياء لمرضانا. وأحببت أن أتحدث معكم عن خبايا التجميل، ويعني أعطوني الفرصة اليوم أن أعرفكم أكثر على ماذا يجب أن تعرفونه من خلال دكتورة أفي. Dr. Effie, welcome to this little chat of ours, and I'm really happy to talk to you today about the life of health and beauty.
Nashwa, can I call you Nashwa?
Of
Thank you.
course.
That's great. Thank you very much for inviting me to have this conversation with you, and also we can talk about the issues and the questions that you want to ask, and I will try to answer them in the best possible way. Then we can help the people that they are listening to us form an opinion.
Inshallah. To start with, I just want to say how proud I am of you as a woman. You have achieved a lot in your life. Mashallah, you have studied more than one profession in medicine, and you have achieved the highest scholarships during all your career. Let us know more about yourself. Tell the audience more about you.
First of all, it's very rewarding having this belief from you that you are very proud, because you are yourself a woman who has actually achieved a lot. My story, if I could start, of course, I'm double qualified from university, so I have studied medicine and dentistry. I was born in Greece, and then when I finished my undergraduate studies, I then moved on to UK for my postgraduate studies. Um, Through certain events, I realized that plastic surgery was the specialty that I would like to be trained. This is because I have a natural inclination to like to do nice things with my hands. When I was in the high school, I used to do jewelry, for example. And then through my training in the medical school, coincidentally, I just happened to follow one procedure where a child who had cleft lip and palate had been operated on, and suddenly I felt a click and I said, this is a surgical specialty that can improve not only the function, but the appearance. And then it was like light. And I thought, this is what I want to do in my life. So UK has a very good reputation about surgical training. So then I moved on to UK, and then I started and completed my training there. It's a very well organized. I mean, I started there in 1991, so it's quite a few years back, but still, the training was very good, and there was a rotation amongst different hospitals where you could study and train in different parts of plastic surgery, because plastic surgery is a specialty, but there are so many subspecialties that you have to be trained at to be able then to fulfill what it is required. So, for example, in plastic surgery, you have burns, or you will have hand surgery, elective and emergency. You have head and neck. You have breast surgery. You have post-bariatric patients, which is actually one of my specialties that I work with the bariatric team. the patients they're having the bariatric surgery when it's satisfactory, and then they lose the um, estimated weight, then obviously they will have to have body contouring surgery, which
Yes.
basically, addresses the chest, the abdomen, the arms, the thighs, the face. So this is one of the subspecialties that I do. So when
360. You do the 360.
360, yes, of course, the 360. It's called like a belt lipectomy. So when the training goes through all the main subspecialties and basically completes what is the necessary training, then you see the exam and then you become a qualified plastic surgeon. And at the time, um, I liked microsurgery, and I was lucky and also honored after an interview process. I was awarded a fellowship in the States where I trained further in microsurgery and hand surgery. And there I was lucky, just the timing was correct because my department, the department I used to work, performed the hand transplants, first and second hand transplants in USA. I think maybe in the world as well. So I was part of this team, part of this huge innovative surgery, and this is something that kind of stayed with me, the importance of helping people. And also, I learned that this was a huge procedure. Huge procedures, they offer, of course, hopefully the great benefit. But then alone, we can't do huge procedures every day. So we offer the daily procedures and even the medium and the smaller procedures. You learn over the time that they're equally important for the patients. So then we come into where we have to deal with aesthetic procedures that they're relatively short procedures. They don't take 7, 8, 10 hours. Nevertheless, they're important because they can change or they can affect, should I say, because I don't agree with the terminology change. They can affect one's appearance, and therefore they can have a serious impact in their
Yeah.
professional and daily life. So they're equally important as well. So everything counts, and when we have to deal with patients, the priority is, the patient, what the patient wants, what the patient is looking to achieve, and how we can offer it in the best possible way.
Tell me how you assess. So a patient comes in saying, I'm not happy with the way I look. What can you do for me? What do you assess?
I think that the first way, and the first question, this is what can you do for me? It's a very general question because I might look at somebody's face and I might think something that this is not what the patient is asking for,
Yes.
actually. So I remember when I started, I was very, very young. So the patient came in and then it was just to improve, plastic surgery. So I started saying, oh, yes, of course, we can help you. Let's see what we can do. And what do you think about this rhinoplasty, the procedure for the nose? He says, oh, no, 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 I'm not here for that. I'm here for my breasts. So from my breasts. So I said, oh, all right. Okay. So it's very important when somebody comes in and says, I want some help, say, where are we focusing? And
Yes.
this is what when you see yourself in the mirror, what you think or you wish that it would be slightly different or it can be improved, then the client or the patient can focus and say, this is what I don't like. I don't like, for example, the way my neck is too lax, the skin is too lax, or I don't like the fact that I have too many lines on my forehead, or I have deep lines around my nose and my lips, or my lips are too small. So then when the patient says, this is what I don't like, then we can focus on that issue and then we can see how we can improve it. So I think the very first question is the answer to the question is, how can I help in what specific matter? What do you think that I can help you with? And you don't like when you see yourself in the mirror every day. That's my my answer to the question, I would say.
You know that I don't believe in changing the features, and it's always been something I use all the time. And I love you for that, because this is one of the things that made me really appreciate your work, because you do not like to change the features. You just enhance the look. You make the people look better. If someone comes with a complaint about the shape of the nose, you do non-surgical procedures that would make look better. If someone complains about the way the chin looks, you do another procedure. You're trying to um, stabilize the status quo of the features until we get old. It's normal that we get old, but the features, when we take care of them, you sustain the looks for a longer time.
I mean, this is very correct because each person is unique. We have our own features. We have what it makes us, our identity. This doesn't mean necessarily that we are happy with, we might want to have a small change or improvement. But what is important, and I think when we love ourselves, which is the important thing, we start from there, we respect ourselves, we love ourselves, and we can improve ourselves with taking care of what we have that we have to maintain. So it's very important. And I like the natural approach, if this makes any sense in plastic surgery, because somebody can say, what do you mean a natural approach in plastic surgery? What I mean is that everything that we might do, we have to do it in such a way that the result will look natural. It will not look out of place. It will look that this is how it was meant to be, and this is how it is. So, as you said, I like to accentuate some of these features if they like, the forehead that might have age, it might have some lines, or the lines around the nose. So we like to go back and give the youthfulness that one had when it was in an age of 30, for example, if
Yes.
somebody's, but maintain this usefulness by maintaining this person's original features and without doing serious changes that may take the face, change completely the face. And then you have this reaction, oh, you have changed so much, as we hear people meeting people, friends in a dinner or in an event and say, oh, look at this person, how much has changed. So that's not the comment we'd like to hear. We like to hear, oh, you look wonderful. You might have come back from holiday, or you had a good night's sleep. You look so rested, or you haven't changed at all since I knew you like 20 years ago. This is what I'm looking for, rather than the opposite. You changed so much. And this
One
is
of
what
the most important thing is the products we put in our bodies, and be it the types of Botox, the types of fillers, the types of hyaluronic acid, so many different products that the surgeons and the dermatologists use on our faces. And how do we, as normal human beings, assess what is best for us and what we should and should not do?
So, as a person, let's say I'm a person and a client or patient, I like to take an advice. You have so many, I agree with you, it's very confusing because there's so many professionals that they deal with aesthetic procedures. So you have, for example, in UK, you have the plastic surgeons, you have the dermatologists, you have GPs that they doing dermatological or cosmetic procedures. You have dentists and you have other practitioners, you have beauticians, you have nurses, you have practitioners that they are within the medical profession or umbrella, and then they kind of perform aesthetic procedures. So it depends. You will decide as a person who is the practitioner that you want to go to. And you see, is this a qualified plastic surgeon? Is this a qualified dermatologist? Is this a qualified, let's say, GP? Or is this a dentist that has been doing a lot of aesthetic procedures over the years, and obviously through experience, it has learned and I have the feedback that it's quite good, or it's a good aesthetic nurse practitioner or beautician, and she has uh, repeatedly good results over the years. So you have to ask as a person, who is this person you're going to go to, and the qualifications that you think that might be required or adequate to have what you want done. It's first the person has to decide what sort of professional and qualifications expects to have. Now, regarding the projects or the products, also there is explosion in aesthetic surgery. If you go to meetings, there are so many meetings every year that you can do either face-to-face or through Zoom, and so many products that they are coming through. And then people can get confused. Even the professionals can get confused. I'm sticking to the product. Of course, I like improvement and change, and I accept that, and I will adjust myself. But in terms of the very basic products like neurotoxins, I tend to stick to the products that I work with, and I know that they have good results, and I can give the best results to my patients. The same applies for the fillers. We hear so many different fillers coming every year. And then, of course, as a practitioners, we have to try and see if the filler is better, because there might be an improvement. There are improvements. And when we try and decide that this is the one, that it gives us the best result with the less complications, then we stick to it. And obviously there are different fillers for different areas, different fillers for the eyes, different fillers for the cheeks, different fillers for facial augmentation. But as long as this filler is approved by the FDA, and then we Google it and we say that this is an approved and well-known filler, then we should accept that, because we should accept that different practitioners use different fillers, as long as the fillers that they use, they're reputable, because obviously there can be quite a lot of complications and we see all the time in the news, you see in the media.
Even bars, even celebrities. I mean, sometimes patients come to us with balls in the different areas of the face, and it looks horrendous, and they want to fix. I know that you need a surgical treatment for something like this. It's not like you can just simply make it go away and disappear because of the fibrosis and what's happening in the layers of the skin. But the issue is, sometimes the patients come in and require certain procedures that we know are not the best for them. And I don't think that you or anyone that I would like to deal with would do that. I've seen you deal with people, and you tell them, no, this cannot happen, or you cannot be putting too much fillers in your lips, or this is enough. This is what makes you look good, because people can have a horrible impact on themselves, and when the realization comes of what they've done to themselves, it cannot be fixed, at least easily. So how do you deal with patients like this?
I think what you say, you mentioned now, one of the complications that it can happen for somebody who has fillers, because you have the common complications like a little bit of bruising, a little bit of swelling expected, and this will go after a few days. And then there are the long-term complications that you mentioned, that the lumps are granulomas, as you said that, or the fact that the filler can move to a different area is called filler migration. So these are things that the risks that they can happen, and the patient has to be aware of that. Now, we can treat these with steroids, or we can treat these with surgery. Because I'm a plastic surgeon, I have cases that they come to me from referrals from other colleagues, and they say, oh, this is in the lips and it has been there and it has causes problems to the patient. Would you remove it? Then I have to remove it and obviously without creating scars that are very obvious. In the past, I think uh, many years ago, I would say 20, 25 years ago, they used to use silicone implants for the lips. And I think they didn't know at the time. I never used them, you see. And I had people coming back with problems. So permanent fillers is something that I would not recommend. And all the fillers that we use now, they're absorbable. And depending on the specificity of it, or each filler, they can last 6 months, 12 months, 18 months, or maximum 2 years. And that's it, basically. We don't use permanent fillers. So that's the one. The filler has to be absorbable. If one doesn't like the filler can be absorbed easily with an enzyme which is called hyalase. So this can be reverted as well. But what I would give cautious to everybody is like they say you cannot have too much of a good thing, but that's not true. You can. So with the fillers, is my opinion is we have to use them cautiously. When we reach a stage that we like the result, we cannot push, and I say push the boundaries and make it a little bit better and make it a little bit better, because then we fall into overuse. And when we fall into overuse, this is when things start going wrong. So faces change, more risks, more complications. So what I would say simple things. First of all, find the right aesthetic practitioner. Second, make sure that you have the right products, that they are approved and they are not associated with high risks. And third, make sure that you will act wise and you will look after your face or your body. And when you reach the stage that you are happy, you would not want to be happier, because then
Yes,
this will send you to the other, and then we
time
start
to stop.
and this is so the person who performs the procedure, the product, and use the products in a wise manner to get the best out of them. That's
Yes.
what my principles are.
I've seen your work with threads and the Nefertiti treatment that you do. You give the most beautiful neckline and jawline. I applaud you for that. And I have seen people that have done the threads, and it looks absolutely horrendous. You can see the threads in the base and here, and are there different types of threads? What would happen for this to occur?
Such a huge conversation. We have to have a different meeting only to talk about them and explain. But
Just
then,
Jordan.
as I said, steps. When somebody has got problem with the jawline, if it's somebody who never had, as you said, the Nefertiti lift with Botox, so I do one Nefertiti to see the result. And then I say, come after 2 weeks, and then we can see how you look like, because there might be a great improvement. And some, they're happy with that. Now, depending on threads, there are threads that they have different thickness, like the PDO, the monofilaments, and there are other threads that they have hooks and they have cogs and so on and so forth, more complicated procedures. So again, it's like a step ladder, in my opinion, because this is what I learned from my training in plastic surgery. We start with the most simple thing and then see what is the outcome of what this procedure is going to offer you. And if you're happy, then you're happy for a certain period. And then when it's necessary, you can move on to the next step. So next step, the threads. People use many and easy of the monofilaments which have less risks, like the PDOs, the monofilaments. Good results to a certain extent. If not good results, then go to the next stage, that you can have the threads that they have, as I said, the cogs and the barbs, and this is like a little mini facelift, because you have to do the incision in front of the ear. You may have 3 threads, different directions on the nasolabial fold, the corner of the eye, and then the jawline, and then this produces a better result. So threading, again, is what are the threads that we have, what are the requirements from the patient, and how we can use the best result, starting with the most simple technique that has the less complications and risks. And then we can move on. Again, the same with the threads. I have heard that there are ladies that they go in there, even monofilaments, they have an occasion, they have to go to a dinner party or something, they will have threads and they will have every couple of months. I said again, be careful, be aware, be cautious. You have to use them when it's required. And I think it's quite indulging to say, oh, I can do something, I have this event, and then go to have a bit more Botox, a bit more threads, a bit more fillers. And suddenly, if you do this too often, then you kind of change yourself and you don't realize in the process that this is happening. So therefore, you have to have somebody, or the person who's looking after you from this point of view, to kind of remind you, or have photographs and say, look, this is who you are, and perhaps this is who you want to remain. And so everything is, again, their condition, what the simplest thing we can do to resolve this condition, the outcome, and how to move on in more complicated treatments, following a step ladder approach, using the right products all the time without compromising with the quality of the products.
I hear you. I sent one of my friends for you. I'm not going to say the name, but she's a lovely lady. But she has always had a problem with her nose and she didn't like it. Now, you did a non surgical treatment for her and it looks immaculate. What do you use? I mean, what, give me
Well,
your secret.
you know, there is the secret. There is, I'm pleased to hear, I think I know who is the friend with about the result. The nose has to fit with the rest of the face, okay? So most ladies, what they have when they do, and it's a procedure, of course, which is called non-surgical rhinoplasty. So which is happening with filler, which has to be a filler that it has um, certain thickness, not the very thin fillers that we use for under the eyes or the marionette lines. So we can build the bridge of the nose in order to hide the hump. So you have to elevate the bridge of the nose so it will be all in one level. Now, this might sound terrible and you think that the nose might look too big, but that's not the case because you end up with the nose. No, my experience, it looks quite thin and quite, tall, elegant nose. So there are little things that you can see, and this is individual, that have to do with everybody's face and what is the nose we would like to achieve and how we can achieve that. And the nose has to be in harmony, in symmetry with the rest of the face. Sometimes we may need to elevate a little bit the tip so we can put a little bit of filler at the tip or the supratip area. But mainly when somebody has got a hump, and this I think is the problem, we need to put the filler in the bridge of the nose up to the hump and then carry on as a straight line. So you give an illusion that this is not there. So that's something which is, like a principle. The secret is not, it's not so much of a secret. It's just to
The magic hands.
exactly. The secret is to see the person that comes with a complaint about the nose, see what we can do with a non-surgical procedure because there are limitations.
Yes.
But now the limitations are not so strict because there are more products coming out and there are more things that we can do. Obviously, the limitation with the filler is that this procedure would need to be repeated because somehow, not somehow, we know that we use absorbable fillers. The filler will be absorbed after a year, depending on the filler we use. So the procedure needs to be repeated. So that's something that you need to be aware of.
Like some of the most pressing questions that people would ask me, and ask for my help with it is the black under the eyes. I mean, this in the Arab world we have this. It's
Yes.
the pigmentation under the eye that gives the certain look of being tired, of not sleeping, of being malnourished, and it doesn't look nice. But there are things now that can be done to relieve this area from this darkness and around the eye. What do you use?
Well, I think this is a problem that I share with you. And I think it's a problem that happens all along the Mediterranean area. And we have this, we see this from a very young age. So I remember, I was studying, and then from the age of 15, I had started having dark circles. So you can start, let's say, conservative approach. I mean, sometimes it's a sluggish circulation in this area, and you have the blood that is very slow. So it's the pigment of the blood that it stays there. So we start like vitamin K. It's the simplest thing to do to start with. And then obviously there are the techniques of putting the slices of cold cucumber, you're putting the oil teak bags, and you start with the conservative methods always and see how you get along. I mean, concealers, it's a great thing that we all use and we know that it works very well. In terms of using fillers, I would say that somebody has to be very careful because when the fillers are used under the eye area, then the skin is usually quite thin, and then they give this blue pigmentation. So one has fillers, and then after that, they see that color of the skin changes, and they get this bluish pigmentation, which is the reflection of the
of
light.
the light.
So there are now fillers that they are specific for the eyes. They have been for many, many years, but they're fillers that they have been improved, and we use, for the under the eye area, that they can be injected in the right level. So they kind of can improve this appearance of the dark circles. But no matter the filler that we do use and improve, I always say follow a healthy life, and then you can use your cucumber slices, and in addition to the filler that you might have to put to hide the dark circles, and also their creams, as well, as we talked about the concealers, but specific creams that they include like vitamin K and makeup together, so it's a combination. So you can use your filler, you try your filler. I'm quite conservative always in my approach, as you see, because I follow a defensive technique. I play it safe in a way. And I think this is good. Okay, I don't like to experiment on my patients, especially when it's somebody that we need to establish a relationship of trust. I have to do little steps till I make sure that I can help, and what's the way I can help to give them what they want. So if we want to put fillers under the eye area, which, it might be the treatment at the same time, in addition to that, we will have to follow with a healthy life and with all the other conservative and surgical measurements that we have to do in addition to. And the dark circles, I'm afraid, they will not go away. So we will need to keep repeating the treatment at
Yes,
regular intervals.
yes.
I,
Yeah, well,
I,
repeating the treatments and making your face look good is not bad. As long as you understand that this is transient, just to trick the lights to make your eyes look
yes,
brighter.
I mean, with simple things like the Botox, we have to go at, I would say every 6 months. Some people like every 4 months, 6 months, or 8 months, and unfortunately, we have to do it. But look, we go to the hairdresser every,
There
you know,
you go.
8 months. So it is a process, and it's something that it should be included now. We are women, we live in this era. There are more that they're on offer for us. It's not what it used to be in the past. So I think a visit to have an aesthetic procedure, although I don't agree, as I said earlier on, that it should be done very often, it should be done in a regular way and should be included in our process of maintaining youthfulness or aging in a graceful way, which I prefer to say that, aging in a graceful way. So people will say, oh, she looks so pretty. And, despite, without saying despite her age, we don't want to come to an age and say, oh, life has been too hard for her. She's been working too hard,
Yes,
we don't want that. We want people to say, "Oh, she looks so pretty and so graceful," and she hasn't changed that much. Should be our logo in life.
yeah, I like that. Now, the acne scars are one of the most asked about, problems in the skin, and also scars in general. I know that you go for the approach of we need to fix the inside as well as the outside so that you get acne free. But what would you recommend?
Well, acne scarring is more a dermatological issue. I mean, acne is a dermatological issue. It needs to be resolved and it needs to be treated with the by the dermatologist. Now, when we reach the stage that we have significant scarring, then the plastic surgeon can come with to assist in certain issues. For example, there are procedures that we can release the acne scarring, with specific procedure with the needle, and then we can put a little bit of filler to raise the depressed area. Or now there are new techniques like using the pen, the EpiPen, that you can use with creams to kind of make the skin look smoother. So there are, I mean, for somebody who is young, I said acne needs to be seen and treated by the dermatologist. When we move on and the um, outcomes are more established, and then we need to do plastic procedures, they are little I would say simple without minimizing it, the issue, because it can be a big issue. They are relatively simple procedures that they can help to produce and give a smoother face. Um, we can't expect 100%, but we can offer great improvement. And the use of the fillers, and each one of them, or release of the scarring and use of fillers is one of them.
Now, I'm a great believer in the concept of a beauty flash, a beautiful facial, a really nice facial massage, facial yoga, and then a touch from Dr. Effie. What would you give a face to give it this beauty flash?
I'm all for it, but I'm all for it because I think, you know, every woman has to start from the, kind of the treatments that they're not surgical or less invasive and go into that. Now, I don't do facial massages, obviously.
I know, but you do the beauty flash.
I do the beauty treatments, but I'm all for it as long, one can manage and start. And it's also, I think, it's the mental state. You feel better. You feel that you're doing something good for yourself, or you give a reward. You had a hard day. You have gone through a difficult situation. You need somehow to make yourself look better so you can have a beautiful facial. And I think facials are also, advanced because you have now so many different treatments that you can have. And I think it's a great reward. So you start with the facial, and then obviously the facial can stop there. It can be, a day's treatment. And then after the facial, you can move on and do things that they're more invasive.
Yes, I totally agree. And it
I'm for
always
that.
works.
For example, yes,
No
it
facials after Botox, no
no,
facials after
no, no.
fillers.
Oh, you have to
Before.
do them before. Okay.
Yes.
So you do it before and then you enjoy it and see the result. And then obviously, if you think that you need something more, then you are there. But I'm all for it. And as I said, there are so many new and advanced creams and techniques and massages like yoga or hot yoga, all these things that you can basically is to keep your body and your face in the best possible shape because this is where our brain lives, as they used to say in the ancient years. So we have to look after our body to be in a good shape. Then it's like looking after our brain and after our emotional, status because they all go together.
I remember that one of the most important things that my male friends would talk to me about is, people when you walk in a place that requires meeting people all the time or representing someone in negotiations, for instance, or being under the limelight for a job. Um, Men require the same procedures that women do, and the simple things that they can do with their features to maintain that healthy, youthful look, not the old, haggard look, is very easy to do. And I've seen more and more men starting to do that. What would you recommend for men to do?
I think that men also they have the same offers than like women, and this generation of men, or not only this, even people that they're now in an age of 50 or 60 that they didn't have this when they were not aware, they still have, this is offered to them. It's there, and then if they have the mentality that it's something that they want because the new people that they're younger, like 30 or 20, they already know about these things. They kind of grown up with them. They're raised, so they're more familiar. Whereas people that they're now in the age of 60, then or 65, perhaps they're not so familiar because it was not offered at the time they were 30. So of course the men, they can have as much as a woman can have. I think the society still is overall kinder because they would accept a man if he has like the lines on the face or the forehead because they see this as evidence of experience, which they all like. And it's not so kind for a woman because if the woman comes of the same age with lines, they say, oh my God, perhaps she's been too tired or she hasn't looked after herself because she's working so hard. So the society overall is kinder to in regards of
Rules.
yes, but still, men, they're more aware, and a significant percentage of men, they want to look youthful because it's good for their career, or because they might be looking for a job or change of a job later on in their life, which is important for them. So usually the men that they come to my clinic, they like to have a Botox treatment, which can improve overall the lines, or leave behind like 20 or 30% of the lines so they can still look natural. We always believe that somebody looking natural is the best. Somebody is beautiful when he looks natural. When it doesn't look natural, there is a big question mark there. So men come to my clinic and they mainly request Botox, and some of them they request fillers, and we do fillers for them. The younger people, the generation that it's like 40, 50, 60, they will require, nasolabial folds or the forehead. Some of the younger men, 20, 25, they might want to have lip fillers as well, which is interesting, and it's new and it's offered to them when it's necessary and needed if they have very thin lips. Um, More rarely I have men that they require threads or, as a facial procedure. Now, obviously, I have gentlemen in my clinic that they come for other issues like a liposuction or an abdominoplasty. So men seek for treatments, facial treatments, as well as treatments that they can improve the body image. And it's, something that we see now more and more, and it's quite common.
Yes. What is the age roughly that men and women start, using products in the face?
Oh, it varies. It varies, and I have to be here very careful because sometimes I have very young people that coming to me and asking for procedures. And you see, because they become more and more aware, and because of the media and it's all exposed and all that, younger people, they can be more influenced, and they may think, oh, I can go and have my lips done, for example, in a very young age. So I think here I will come. I mean, in UK, it's not allowed to do any aesthetic procedure for somebody who is less than 18 years of age. And I think, in my opinion, this is still quite young, unless if there is a medical issue, like, say, for example, prominent ears, that we see in children. Then there is a medical reason, a medical condition, then I can accept that. If it's for aesthetic purposes, um, I think that one has to consult this client or patient very carefully and honestly. And I think I'm very cautious before I embark on doing aesthetic procedures like Botox or fillers to girls that they are, or boys even, but mainly girls that they are very young. Because sometimes I think it's the result of being influenced by somebody else,
Yes.
and might not even be their own decision.
Or peer pressure, mere
Yes,
peer pressure. Yeah.
exactly. And not be their own decision. So this has to be assessed and checked very properly to find out if this is what one wants. So I don't want to give you kind of cut-off ages and say from the age of this and this, but
It
those
depends.
ages, I would say, towards after the age of 25. I would say after the age of 25. And the same I would say for something like fillers, because somebody has to have grown and, have the opinion that, this is what's happening and I need to have my lines reduced. I mean, in the age of 25, some women they have lines, especially ladies that come from countries that they don't have a lot of sunlight, and they go, for few to Mediterranean countries. So you have
So,
the sun exposure for 1 or
yes.
2 every 6 months. So
Skin
this is
damage, instant skin damage.
so
Yeah.
what it is, SPF 50 for every person. It doesn't matter if it's European or if it doesn't matter if it's from another continent. When you expose yourself to the sun, you might have better resistance to the sun, but you have to work a cream with SPF. And this can change from, 50 to 30 or 40, depending on the type of the skin. So I start with that. So we have premature aging sometimes in certain individuals that they have very thin and fragile skin, which is not meant to be exposed to the sun. So we have premature aging. So would I start Botox injections in somebody, in an individual like that? I would probably do that because they need it. So it depends the problem that they present, the requests that they have, and the causative, and the age, of course. So if they all together they can join, and I can say, oh yes, this is a person that needs Botox now, despite the age, because it has the problem. So fair enough, I will move on with the procedure. But if I see somebody who is 16 or 17 coming for a lip filler because the friend has got very
Bigger
prominent,
lips. No.
they feel that they're not good in the competition, then I would say, please think about it. And please, it's not something that I would offer to you right now. I would like you to think about it again. And when you think, in a couple of years that this is still what you want, then I will do it for you. I might be losing some clients or patients like that, but at the end of the day, it doesn't matter, because if I feel that I'm doing something based on ethics and morals, and I don't think I'm too conservative, I think I'm pretty reasonable, then I feel that I offer to the patient what they want. And sometimes the right decision is not to offer. It might be
Yes.
it might be
I totally agree.
yes, the patient, the best interest of your this particular
Yes.
specific patient. So sometimes not to offer is equal and good
Yes.
enough as to offer.
So no sometimes is the best answer.
Sometimes we can say, not right now. We can't, no, it might be a bit too uh, direct, but you can say, not at this stage of your life, but a little bit later on, and under this circumstance, when we can do that, then we could. I mean, no, but it's not something which can be done now.
Now I'm filling everyone on a little secret that I have. I went to Dr. Effie a couple of years ago, and I always suffer from permanent migraines. And she has offered me something amazing. She actually did Botox uh, at the back of my head and the neck, and it was like magic. The tensed feeling that I always have in the back of my head disappeared. Do you offer this often?
I have to say something here. As a plastic surgeon, when we do the Botox for the face, I've noticed that ladies that they have tension migraines here at the front of the face, then they feel that they get better. I do not offer regularly Botox at the back of the neck because it's something that, might be a pain doctor, or a neurologist. We have to basically um, diagnose what is the cause of the migraine, if it's tension migraine, which muscles in. So, but I think I offered it to you as a temporary.
It worked.
Yeah, just to
Worked.
get it out, but not really something that I would offer regularly in my clinic.
Yeah, but you'll continue doing it for me. I will not let you off the hook at all.
Off the record.
Now, something else I wanted to ask you about. Now, sometimes people want to do the Botox every 3 months, and sometimes they want to do it every 6 months, sometimes 8 months. Sometimes, with celebrities that I know, they do little bit of Botox every couple of weeks. Is this doable?
What I would say that we're all individuals. We live different lives. We do different jobs. There are different expectations on us, and therefore we should adjust. These specific requirements that we have with the way that we're receiving Botox. So I wouldn't give Botox every 2 weeks. I don't think that if one has a session of Botox, even if it's a tiny amount, require after another one after 2 weeks, because sometimes it takes 2 weeks to see the outcome of
Settle. Yeah.
patient. So why would you give another one after 2 weeks? But what I have some of my ladies that they would require every 3 months, but they come and we make sure, and they say, I need a baby Botox. So when they know baby Botox, so we give an amount, I mean, depending on the function, how much the muscles are moving. Because if the muscles are not moving so much, so there is no, because this is how you decide, the units, because I always write in my paper, in my notes, how many units of Botox I've given. So every time, each time that one comes to the clinic, I know what I have done before. I have a full idea, the units I've given, and I see the results. So if depending on how much movement of the muscle, then we can give the amount of Botox units. Now, as I said, a full Botox that is quite strong, it can last, in my experience and in my hands, 6 months. I have some other ladies that they want to come after 8 months. This might be uh, being busy or financial reasons or whatever reasons. And it's good, even after relatively can stay up to 8 months. I mean, you see the difference, because you see the difference, but then, this is the time they want to take, and this is fair enough. And what I mean with this, I mean that Botox is metabolized. As it is metabolized in you can see that the movement of your muscles is coming back. So, but of course, it's coming back. You don't want to have a phase that it's emotionless. So
Frozen.
even
Yes.
after the first session, even after 2 weeks when I check, there should be some 30 to 40% of movement, because we want to have emotions. We want to show when we are happy, when we are sad, when we want to smile. So it has to be there. So I maintain that, and that's my principle. And I don't think that the frozen look is a very good look.
No.
Uh, but it's up again to the individual. It's something that we say we need to discuss. But when the muscle movement comes back, which can be after 3 or 4 months, then you can carry on having some muscle movement up to the extent that you think that, oh, I'm not happy now. But when we allow the Botox to be fully metabolized, we kind of going back to square one. So it's like starting back up again. So we have to find the right time that is kind of going, or it has been absorbed up to 80 or 90%, and then there to have the new one done. So we maintain the muscles working in a lower level to what they would have been working if they didn't
Yes.
have Botox, because then you maintain a continuity kind of treatment. And I think the ladies, they get to know themselves. They don't need me to remind them. They know when it's the time to come, so they make their appointments on their own. I
We
don't
poke it up.
I don't really send, many people send reminders and say your time is now, and then when you got, I do not actually give my patients the freedom to decide when
Well,
because they know. So it's all up to the lady or the patient to decide when they're ready to come without having any pressure from reminders. And now is the time to come back again. I'm not very keen on that. I just allow it.
what about the neck, Effie? What do you do with the neck?
Well, the neck in terms of, skin laxity. We start for the ladder, the ladder of plastic surgery. Simple thing, have an FTT Botox treatment. See the results. You might like the results. And then if you think that it's not good enough, then we can move to other techniques. A very simple technique is, and I don't know if I should talk about products, is a product that is not the traditional filler, but it has about 36% of hyaluronic acid that it's offered. You can do a facelift with that. It's in the company's website, but also this product is used for the neck and for the hands. So you do little injections that they look like lumps to start with, and after that, this product is absorbs the water from the entire area, and then it diffuses and it gives uniform improvement and fullness of the neck. So you might like this product. And as I said, I don't know if I should give names, perhaps I shouldn't. So this product has got very good results. And you have to have the first session, the second session, sometimes the third session every month. And then you can leave it for a year or a year and a half. So you have your Botox, you have your filler, the second step. You're not satisfied with the filler, then you can move on to the threads. And if you try the threads and then, see the results um, after a year because they stay the threads for a bit, then you don't like it, you can even think of surgical neck lift. So it has to be a progression. It has to
Yes.
be rational in taking decisions. That's why instead of running or rushing from one to another. So you have established that something which was simple, it didn't work or it didn't give you the result you wanted, and then you can move on. So for the neck again, Botox, fillers, threads, surgery.
Now, body contouring. I've seen the pictures on your mobile. Amazing. Immaculate work. Now, you always tell me that you ask the women if they're gonna have more children. You ask the women, the question, so that you can assess what to do for them at what age, right?
I think I have to say the body contouring is something that I love, and I have been doing, since always, since I was a trainee. I started in breast surgery, breast augmentation, breast reduction, breast uplift, abdominoplasties. So I have sometimes, apart from the bariatric patients, that they're patients that they have gone through a process, and actually quite difficult process, and they have achieved. So they are achievers, and then they have decided that they want to improve what is left there after the weight loss because it's like folds of skin. But if we go, so this is a different group of patients, and we shouldn't consider them the same with the patients that they are more cosmetics because I have a lady that had one pregnancy, young 30, 32, and then after the pregnancy, she has a different abdomen. That happens. What are we going to do about it? I always advise the young ladies after one pregnancy to wait for at least 7 or 8 months because the muscles themselves, the
Yes.
abdominal muscles, they take time to recover
Heal.
and to
Yeah.
come back to the state
And
that
they
they
have to come back as well.
exactly, exactly the two muscles that they open, that they're in front of the abdomen, they move forward and outward. So these muscles that they're like this, they move forward and out. So you have to allow these muscles to come back and together. So to the state that they were before. So this needs at least 7 to 8 months, even a year. Then when this settles, they go to the gym, they do what they have to do. And this is my advice because I don't want my ladies to have unnecessary procedures. I know that this is not a very good policy from the financial point of view, but
This
it's
is what we have to advocate.
a very wise policy for the patient himself or himself. So then when they are ready and the time has passed and the abdomen has achieved or has recovered the maximum income, then we can proceed and do the standard abdominoplasty or tightening of the muscles or improving the belly button and so on and so forth. And because it's a procedure that, takes time and then they might have to stay in the hospital for a couple of days, they go through a process of healing. The skin takes 3 weeks, the muscles are taking 6 weeks. I always ask the question, the same for the breast reduction. If they're having the plan to have a child the next year, the year after, it might be better to postpone the surgery, even for the abdomen or for the breast, because it might be that the second pregnancy may have the same effect and they may have to go through a second procedure. Now it's up to an individual. They might say, I want to have a procedure now, and I want to have a procedure in 3 years after my second pregnancy. It's up to them. My obligation, if you want, my moral obligation is to tell them, to warn them, give them the information that once it's done, because some of them they ask, if you're going to make my tummy so tight and my muscles, would I be able to have a second pregnancy? And then I say, do you want to have a second pregnancy? Why you don't go ahead and have it done? And then we can do the final procedure when you are ready. And I give the information, and then it's up to the individual to take it or leave it, and make decisions.
What about the body fillers? It's become a trend now.
I know, they are. And of course, we can perform um, like a small breast augmentation with the fillers that are there for the breast. But again, it's short-lived, it has to be repeated. Um, I'm not so keen about the fillers on the calves because I have seen a lot of complications, and many people have, not my patients, they come to have them removed, especially if they have implants like silicone implants. And the same applies for the, and I talk about my own practice. I don't talk about, so silicone implants for the calves, some silicone implants from the gluteal area. Again, they have their own risks. What I would say here, which I find positive in my practice, the best implant that one can put into herself or himself, as far as the body contouring, if we want to augment, I have found that it's the fat grafting, liposculpture. So taking a fat that it comes from the abdomen, and then you can use it for another area of the body, like the breast or even the gluteal area. I'm not saying that these procedures are not with zero complications or risks, but in my opinion, it's a quite physiological way to augment areas of your body in the most natural way. And that's what I have to say about it. We can put also fat fillers on the face as well. They give good
Yes.
results instead of the HA hyaluronic acid fillers. Good results. Obviously, they last for a certain period. You can't expect somebody to have a liposuction every year just to do some fillers on the face. But if they're going to have it as one off and see the result, I think it's good. So it's a good option, and it can be offered for augmentation in face and body, and it's a very natural way. And actually, you get um, two birds with one stone. You move the fat from the areas that you don't want it.
That's the problem. The cat just goes to the areas that it shouldn't go to.
Well, well, we accept what we accept, and then we move on and we make it better. Thanks
Yes.
God, we have so many ways of making things better now.
I have taken you from your patients, and I really appreciate talking to you today. And I'm so happy that you're finally with us in Abu Dhabi, and you're going to see all my friends and colleagues and patients that would love to have your treatments. God bless you, Effie, and you are always welcome in Abu Dhabi.
Well, it's a pleasure, and I'm really happy to be here. It's a lovely, lovely city. It has culture, it has this sense of serenity and peace, and also lovely people. I'm looking forward to meeting you.
Thank you so much, Effie. God bless.
My pleasure. God bless.
Thank you. طبعًا أفي موجودة في مركز دلما الطبي، وإذا حابين إن أنتم تتكلموا معاها تاخدوا free consultation هي موجودة، وإن شاء الله تشوفكم وتساعد اللي تقدر تساعد عليه. شكرًا.